Just between 1904 to 1940s, a systemic disease known as pellagra affected 3 million people and caused 100,000 deaths, and a whole lot more before that period. This was known as the greatest riddle in the world of medicine because after its discovery in 1735, for nearly 2 centuries, scientists after scientists conducted research after research just to come up with the wrong answers. It was until 1937 when they finally discovered that pellagra is caused by vitamin B3 deficiency, meaning one can have pellagra even today just by not taking enough of this vitamin. So let's take a look at what is vitamin B3, how B3 deficiency is linked to pellagra, and most importantly, how to prevent it. Vitamin B3 is known as niacin or nicotinic acid. No, it's not the same with nicotine, which is a potent toxic from tobacco we should avoid. This is nicotinic acid we should take. You can take various forms of B3, but your body is going to convert all of them into one active form known as nicotinamide. Remember, this one's going to give us the benefit because about 400 different body enzymes depend upon nicotinamide. These include the two most important ones, NAD+ and NADP+. NAD+ is used for breaking down catabolic reactions such as break sugar, fat, and protein to produce energy. On the other hand, NADP+ is used in building up anabolic reactions in which the fatty acid and cholesterol are synthesized. Simply put, nicotinamide is important for both breaking down the fat to produce energy and building up the same fat to save energy. It is also used for DNA repair and cell signaling. So it is a pretty big deal. The benefits of niacin include proper regulation of fat, sugar, and proteins in the body, including in the diabetic patient, antioxidant properties, DNA repair, prevent pellagra, and improve skin health, and of course many other things to balance metabolism. So the deficiency of such important vitamin is going to be a pretty big deal too, right? Pellagra, if left untreated, can lead to death. Its symptoms primarily occur in the skin, GI tract, and the brain, where nicotinamide is most needed. We can remember the symptoms with 3 Ds: dermatitis, diarrhea, and dementia. That's a bit of mouthful. 3 Ds for short. Dermatitis because it produces sunburn-like itchy rash, lesions in legs, face that turn black and peel. Diarrhea involves, diarrhea, glossitis, vomit, and abdominal pain. Dementia include hallucinations, headache, poor memory, tingling in limbs, and paranoid behaviors. These are the other awful symptoms that can happen during vitamin B3 deficiency. The deficiency is mostly correlated with poor diet, as seen in refugee camps, poverty, and places that have low access to good meals. Tryptophan is an amino acid from which nicotinamide can be made, so the deficiency of tryptophan can also accelerate pellagra. Particular medications, alcoholism, genetic and tumor-related problems are other causes of vitamin B3 deficiency. Well, I forgot to mention the other name of vitamin B3, which is pellagra preventive factor, or PPF for short, which means you can just prevent pellagra by eating the right diet containing PPF. From the animal sources, we have chicken breast, turkey breast, salmon, tuna, bacon, beef liver, and pork. From the plant sources, we have brown rice, peanuts, sunflower seeds, banana, fortified food, and many more. So can I just say a salmon a day makes the pellagra away? Well, it probably make your money away too, but that's a lot of food, isn't it? Same as the knowledge you're gonna get from MDKB. Just a little self-promotion. Subscribe. Just include these so we will not have pellagra. Well, that's until we have something wrong with our body. As such, we have to go to the doctor. Let's see the dosage for vitamin B3. In adults older than 14 years, 16 mg of niacin for male and 14 mg for female. 18 mg for pregnant women, and 17 mg for lactating mothers. And this is the chart from the National Institute of Health. Here, Ne represent niacin equivalent, which means 1 mg Ne is equal to 1 mg niacin, but 60 mg of tryptophan, from which 1 mg of niacin will be produced. Don't take too much niacin because there are studies that show taking high doses of niacin lower blood fat levels. But that doesn't come without serious side effects. Consult with your doctor. We can now successfully prevent pellagra with the help of vitamin B3. But what about another disease? I mean real-life zombie disease. Yes, it is terrifyingly. Stay safe, stay healthy, and check out that it's not some clickbait. And subscribe to the channel to help us reach 1,000 subscribers. See ya!